Ano kayang gusto kong maging paglaki? Accountant? Flight attendant kaya? Doktor! Gusto ko maging doktor! Oo nga! Gusto ko maging doktor para makatulong ako sa mga maraming tao.
Malapit na magsimula ang college, hindi pa rin ako nakakapaghanap ng gusto kong course. Ano kayong magandang pre-med course? Maganda pa, mag-search na lang ako sa Google kung anong magandang pre-med course. What are the different pre-med courses? Oh. Nursing. Medtech, dentistry, pharmacy. Oh, teka. Ano to? Physical therapy? Ano kaya yun? Search ko nga. What is physical therapy?
Physical therapy, PT, also known as physiotherapy, is one of the medical health professions that, by using evidence-based kinesiology, exercise prescription, health education, mobilization, and electrical or physical agents, treats acute or chronic pain, movement and physical impairments.
Ah! Ayun pala yun. Ano namang ginagawa ng mga physical therapist? Saan kaya sila nagtatrabaho? What does physical therapist do?
Physical therapists evaluate and record the patient's progress. Physical therapists help injured or ill people improve movement and manage pain. They are often an important part of preventive care, rehabilitation, and treatment for patients with chronic conditions, illnesses, or injuries.
Galing naman neto. Oh. Different physical therapy practices in different physical therapy settings. Ano kaya to? Mapanood nga.
In every session of rehabilitation, physical therapist is responsible in taking the vital signs of their patients before, during, and after the treatment.
Good morning, ma'am. I'm Christine and I'm a physical therapist. Ngayon po, kunin ko po ang vital signs po ninyo, which is yung temperature po ninyo, yung heart rate, yung respiration po ninyo, respiratory rate, at saka po yung blood pressure po ninyo. Pero bago ko po yung kunin, mag-hand rubbing po muna ako, at saka prepare ko po yung mga equipments o yung mga gagamitin ko po.
The physical therapist always performs proper hand hygiene before touching the equipment and the patient to prevent contamination. Make sure that all of the equipments are clean and in good condition. Equipments: a watch with a second hand, digital thermometer, sphygmomanometer, blood pressure cuff, cotton and alcohol, pen and paper. Explain the procedure and the benefits. Make sure that your patient is comfortable.
Po natin ito to establish ng database of values, to assist in goal setting, and to assess your response and effectiveness of the treatment. Okay po yun?
Ngayon po, kunan ko na po kayo ng temperature.
Make sure that your patient's axillary region is dry. The thermometer is held firmly between the thumb and the forefinger at the end of the opposite bulb.
Ang temperature niyo po is 35.1 degrees Celsius. Normal po ito. Kukunin ko na po yung pulse rate po ninyo. Okay lang po ba yun?
Okay.
Select the pulse to be monitored and place the first 3 fingers squarely and firmly over the pulse site. Count the pulse for 60 seconds.
Ang pulse rate niyo po is 74 beats per minute po. Normal po yun.
Respiration or respiratory rate. Place the patient's arm across the chest and count the respirations.
Count the respirations for 30 seconds and multiply by 2.
Yun niyo po, mayroon po kayong 13 BPM. Normal po yun. Kukunin ko na po yung blood pressure po ninyo. Okay lang po ba yun?
Okay lang.
Okay.
Blood pressure. Use an antiseptic wipe to clean the earpieces and the diaphragm of stethoscope.
Extends exposed arm and places at the heart level with the elbow. Wraps the blood pressure cuff around the arm approximately 1 to 2 inches above the antecubital fossa. Make sure that the sphygmomanometer registers in 0.
Don't forget to ask the patient if she or he experienced any pain or discomfort while doing the procedure.
Ang blood pressure niyo po is 128/71 mmHg. Normal po yun.
Okay lang.
Oh. Ngayon po, meron po ba kayong tanong?
Wala na.
Wala naman po. Okay.
Good morning, sir. I'm Twyla Alexis, your physical therapist for today. So, based po sa medical records niyo po, meron po kayong pain na nararamdaman po sa right hip niyo po. Tama po ba?
Opo, ma'am. 3 weeks na.
So, na-check ko na naman po yung vital signs niyo po and normal naman po lahat ang results. So, before we start our session po, I would like to give you some background about what we're going to do today. So, ang gagawin po natin ngayon ay range of motion, which is active assistive range of motion, kung saan ikaw po, patient po, meron pong voluntary movement na manggagaling po sa inyo. So, ako po, i-assist ko lang po kayo as your physical therapist. So, ginagawa po natin to in order to reduce your pain, lalo na po sa right hip nyo po, and to increase blood circulation, and to increase awareness of joint motion. Do you have any questions po ba, sir?
Wala po, ma'am.
Okay po, sir. So, gagawin ko lang po yung hand hygiene, and will it be okay po ba if I touch you po?
Yes po, ma'am.
Okay po. So, i-assist na po kita sa paghiga po. Okay, so ang gagawin po natin ngayon ay internal hip rotation para po ma-reduce po yung pain sa right hip niyo po. So, if you feel any discomfort or pain po, sir, just tell me right away po. And I advise you po na sabayan po sa akin ng pagbibilang. Para po in order to avoid Valsalva maneuver or yung pagpigil po ng hininga. Okay lang po ba yun, sir? Okay. So, I will lift your right leg po, sir, and position it 90 degree. And then, so sir, sabayan niyo po ako ha. 1, 2, 3, 4, 5, 10. So, nakaramdam po ba kayo ng pain or discomfort po nung ginagawa po natin yung exercise po?
Wala naman, ma'am.
Okay. Do you have any questions po ba, sir, before we end po our session?
Wala naman po, ma'am.
Okay, so, pwede na po kayong... Okay, so balik po tayo dito next Wednesday since ang treatment plan niyo po ay 3 times a week. Thank you po!
Did you know that physical therapists can also do sessions in their patient's residence? Home health where the physical therapy is provided within the patient's place of residence.
Good afternoon, ma'am. My name is Joyce, the physical therapist for today.
Good afternoon po.
So your mom told me via call that you're experiencing prolonged cough and back pain for a week already. Is that true po?
Yes po.
Okay, ma'am. So what we'll do in today's session would be cupping massage. Its purpose is to establish health, promote wellness, and to relieve discomfort. This massage is specifically used to loosening mucus and phlegm in the chest cavity and increase blood flow. I've already performed proper hand hygiene. Is it okay to touch you po?
Yes po.
Okay, ma'am. So, maybe first to expose the area that needs to be massaged and to provide modesty.
Okay po.
Okay po. So, I'll have you po in a prone position. So, dapa po tayo. I'll put some support po. So, start na po tayo kung may nararamdaman po kayong discomfort or pain during the massage. Sabihan niyo po ako, and if may concern or katanungan, please tell me right away. So, I'll put some lubricant po sa back nyo. And you should start po sa massage. Do you have any question po? Any pain or discomfort?
Wala naman po.
Glad to hear that. Tapos na po session natin. Thank you po for having me.
Thank you din po.
My name is Lingad and I'll be your physical therapist for today. So what's your name po, ma'am?
My name is Rika Servano.
Okay, saan na po nangyari sa amin natin?
While playing volleyball, I think I got injured.
Okay. So yung dito po ba? Masakit po ba yung weight natin? Mag-bandage po natin.
Kasi, mga baliw yung mga kampi ko. Lahat kami na.
Open na lang po natin. Kahit po ba?
Hindi.
Okay na po ba? Pag hindi po kayo komportable, pwede nyo na po tanggalin yung bandage. Ito. May tanong pa po ba? Salamat po.
Grabe! Ang galing pala ng mga physical therapist eh. Dahil sa video na panood ko, physical therapist na ang kukunin ko. Tama. Physical therapist nga ang kukunin ko.